Are you struggling with the planning phase of the nursing process or care plan? Welcome to the chaos of nursing priorities, where life saving decisions meet 12-hour shifts. Think of that show Survivor, only the hospital edition. Instead of voting people off the island, you're deciding who gets pain meds first and who has to wait. Picture this: you have one patient's appendix is staging a dramatic exit. Another patient is demanding a call to check on their cat, while a third patient insists their toenails are top priority. Meanwhile, your coffee's getting cold, your stethoscope's missing, and the call lights are blaring. What do? You panic? Do you cry? No! You prioritize like a pro, okay? Whether you're a student or a seasoned nurse or anywhere in between, this video will help you master the art of nursing care. We'll cover Maslow's hierarchy of needs, smart outcomes, and how to keep your sanity intact while doing all of this, with a few laughs along the way. So grab your clipboard, channel your I've got this energy, and let's tackle the ultimate challenge of how to decide what matters most when everything feels like an emergency. Let's do this. Some common mistakes when writing your outcomes. For example, writing interventions as an outcome. Okay, you offer patient water every 2 hours. You can't write the outcome like that. No. Instead, a correctly written outcome in this regard will be the patient will drink 60 milliliters of water every 2 hours. You see it? Very specific, very demure. Another common mistake is using measurable verbs. For example, the patient will understand their medication. No, don't do that. A much better written outcome would be something like the patient will list 3 side effects of their medication. Another mistake that is commonly seen when writing outcomes is being too vague. For example, writing something like the patient will cope better. No, instead you can write something like the patient will identify 2 new coping strategies and demonstrate reduced stress behaviors. Listen, outcome identification and planning are where the magic happens in nursing. It's where you take all the data, the insights, and the relationships you've built and turn them into an actionable, patient-centered plan. Whether you're jotting down a formal care plan or making a quick mental note, your goal is the same: to help your patients thrive. So think big, stay flexible, and never lose sight of the person at the heart of it all. After all, that's what nursing is all about.